Hello, Professor Menango. Nice to meet you. Nice to see you here. Can you please introduce yourself?
I'm Professor Meningaud. I'm a faculty, and I was the head of the Department of Plastic Surgery in Henri Mondor Hospital, who is a very huge hospital here in the area. And now I work in a private since September.
So, your career began in fundamental research, particularly in molecular pharmacology,
Mm.
before leading you to plastic surgery. How does this dual scientific and clinical background continue to influence the way you practice today?
Yes, at the very beginning, I was working in molecular biology, but I had a frustration at that time because I didn't see the purpose of what I was doing. And I was spending the full day to concentrate some molecules, and I didn't see what were going on with all that. So gradually, I decided to practice medicine. At the beginning, it was cardiology. Cardiology is very pragmatic, and then I met some surgeons, and so they convinced me to switch to surgery. At the beginning, it was general surgery, and I was supposed to be a digestive surgeon. And then I did a rotation in a department of plastic surgery, and I was amazed because there were so many possibilities. It was unbelievable. So I decided to become a plastic surgeon, but I did another rotation in maxillofacial surgery, and I was even more amazed because you can modify the identity. So I decided to do a transgender surgery, facelift, and I became a professor. And then I was the head of a department of plastic surgery with breast surgery, etc. I thought that it was better to be a real plastic surgeon, and then I became a professor of plastic surgery.
Thank you. So, you often refer to the holistic dimension of plastic surgery, integrating both technical mastery and patient psychology. How does this vision shape your approach to contemporary aesthetic surgery?
Actually, when you do anything in medicine, uh, whether in medicine or in surgery, the purpose is always to make that the patient feel better. And I think that aesthetic medicine or aesthetic surgery is a really medicine because the purpose is not to change the shape of the nose, for example, it's just to make the patient to feel better. And because he has a slight psychological problem with, for example, with his nose or the sagging of his face. And what we do, we are a kind of psychologist, but with a knife, and we try to make the patient better. So if a priori we assess that this patient is not going to benefit from the surgery, it's better not to treat the patient. But if we think that there is a possibility to make the patient to feel better, uh, then there is a purpose to perform the surgery. It is the same with burn patients. With burn patients, we know that when they have a lot of burn sequela, we know that we are not being, it is not going to be possible to make them completely perfect like before. But with some surgeries, we can gradually improve the sequela, and then they feel better.
Um, you have taken part in 7 facial transplantations, procedures at the very age of what is possible. How have these experiences changed your perception of the face, identity, and the surgeon's responsibility?
Actually, not too much, because from the very beginning, I know that this was an important challenge. I was not sure that the patient will feel better because the patient of face transplant they have a trauma, but they don't have any disease. And with face transplant, because of the immunosuppressant treatment, we transform injuries to diseases. And this is the problem of this patient, because with the immunosuppressive treatment, they can have some cancers, they can have some infections, the surgery is very dangerous. So I was very satisfied from the technical point of view, because to be able to do that, because it's very difficult from the surgical point of view. So I'm very proud of that. But to be honest, from the very beginning, I knew that this was very difficult to do, but this was not the main point.
You are sometimes perceived as primarily an aesthetic surgeon, whereas your reconstructive and research activity is considerable. Does this boundary between reconstructive and aesthetic surgery still make sense today?
Yes, because in fact, it's like a man with two legs. You need cosmetic techniques for reconstructive patients, and for cosmetic patients, you need also to have some knowledge from the pathology. For example, yesterday I did a facelift on a patient who had silicone, injection of silicone, and then I had to do the facelift to improve the shape of the face, and at the same time to remove the silicone. And the silicone was stuck to the nerve and to the main duct of the parotid gland. So if you don't have the knowledge of to remove, for example, parotid glands, if you don't know the anatomy of this region, it's very difficult to combine an aesthetic surgery with the removal on some cysts that are stuck to the nerve, to the facial nerve.
You are currently working on alternatives to facial allotransplantation. Without going into confidential details, can you share the main lines or thoughts guiding this research?
So what we are working on is to the possibility to get some chimerism, and we know that some structure of the face, especially the bone, can be invaded by the cells of the patient, and we can work also with the techniques of regenerative medicine with stem cells taken from the patient, and we can combine also all these techniques with prosthetic devices that are improving over time. When we see what we can do with a smartphone today and what we could do at the very beginning 10 years ago, it's unbelievable. So I think with the prosthesis is going to be the same. The robotics is improving, and I think that for the face, the robotic will improve also. And for example, now you have some windows there. When you pass a door, the door open, and we can imagine a prosthesis that when you have your fork with the food near your mouth, the mouth is going to open. And you can also imagine that we can have some silicones that the color can change with the weather. So I think in the future, maybe in 10 years, we will be able to have a very interesting prosthesis for the face. And right now, it's feasible to impact some prosthesis with some special implants, zygomatic implants that are very, very strong. And this was not feasible 10 years ago.
Your recent transition to private practice marks a significant turning point after an exceptional academic hospital career. What does this shift change concretely in your daily practice and in your relationship with patients?
Actually, not so much, because since September, I'm in private practice I've been for 5 months only. And however, I have published 5 papers. So I continue to teach. So the difference is that I teach in a private setting, and I continue to publish at the same pace. So the difference from the quantitative point of view is almost the same. I continue to treat patients, to do care, to do teaching and to do research. But I think I'm more efficient. For care, I can give more quality, a more exclusive treatment. For example, the rooms for the patient are better. I can control better the OR. I can control better the staff. So I have more tools for that than I had in a state hospital. And regarding the teaching is unbelievable, because now I have a very good setting with the cameras, the screens, everything is okay. And to receive the students, we have a bar to drink, we have for the coffee, for everything. They are very comfortable. We have all the hotels nearby. It was not possible in my state hospital because we were in a far area where there were nothing around. And for research is easier, because we can deal directly with the companies, and is really easier because in the state hospital there are many structures in between, so it was really too difficult. It was getting worse and worse. So I really prefer. I think the future now, at least for me, is to work in private.
So you mentioned that private practice allows certain techniques, such as the deep plane facelift or regenerative surgery, to be taken further. Do you see this setting as more conducive to control innovation?
I think we can go further because we control more the staff. In a state hospital, you cannot buy what you want. So in a private, you can decide and say, okay, I need that because the quality will be better, and the decision is right away. You decide and you get it. So it's in that sense.
As a trainer and director of numerous university degrees, you have expressed concern about the evolution of manual skills among young physicians. How should surgical training be rethought in light of this generational reality?
Yes, I have noticed that I have been teaching in a state hospital for 26 years, even more. And I have noticed that the skills, the manual skills of the residents were decreasing, and especially after the COVID. And I think it is because in my when I was young, we were all doing a lot of crafting with our hands. We were repairing, for example, our bicycles. We were doing planes, ships. We were painting the troops. So we were doing a lot of things. And today, of course, the youngest, they are using a lot of time the screens. So of course they developed other skills, but regarding the ability to do things with your hands, of course this is decreasing. I can give you a sort of metaphor. For example, if you were to learn English, you are French, and you were to learn English when you are 25 years old, with a lot of efforts, you are going to be able to speak in English, but you are not going to look like a bilingual, to look like a native. And it is the same with the hand ability, because if you begin to do difficult things when you are 25 years old, and it is when the residents come to us to be taught in surgery, they are 25 more or less. So they begin their residency when they are 25. And if you begin to do difficult things at 25 years old, you cannot be bilingual from the hand point of view. You are going to be able to do simple things, but not with the same ability of children who, when he was 5 years old, he was already doing a lot of difficult things with his hands. And you have to bear in mind that in the brain, the area of the hand is bigger than the language. So it is very important to make the child do things with their hand from the very beginning. If they spend too much time with the screens, I don't criticize the screen. We can do a lot of things. It's very interesting, and they develop other skills that are important for the future. But there are only 25 hours in a day. So if they take too much time with the screens, they cannot take time to do things with their hands. So I think we have to keep that in mind, and maybe to develop new training programs, taking that into account, because the robotics in the future will not be able to do everything. In some areas of surgery, yes, for example, maybe in ophthalmology, but in plastic surgery, the hand, at least for the 20 years coming, we still need surgeons with good hand skills.
So, do you believe that simulation, technology assist surgery, or artificial intelligence can compensate, at least partially, for this lack of early manual culture?
Yes, to a certain extent, of course, some robots will help us. And I think that in the near future, just for the house, the housekeeping, we will have a lot of robots. I think that maybe in maximum 10 years, there will be more robots like human shape than human. So of course we are the life is going to change completely because of the robotics. There is a delay between the AI and the robotics, but because but even the AI is going to develop dramatically in the future, because what is limiting the AI today is the power, the electricity. Because to develop a huge AI, we need a huge possibility to get power. But this is going to change, because now they are thinking about having the data center in the space and to get the energy from the sun with something that is the good combination, because there is the efficiency to get the power from the sun in the space is better than on the Earth, but in the space the space is very cold, so it's very good for the computers too. So I think we will have in the future very good data centers for AI, and this is going to improve also the robotics, because the robotics will be equipped with the AI. And what we can do today, we can record all the gestures of the surgeons all over the world with, for example, the Da Vinci robots. And then with AI, we can gather all this knowledge to perform the most important surgeon of the world, because he has the experience of all the surgeons of the world for 1 century, for example. I exaggerate a little bit. So, and with the how we call that, the new computers, I don't remember the name.
It's quantic.
The quantic computers, it will be amazing. It will be amazing, the possibility. And we are about to control this technology also.
So AIME has established itself in just a few years as a congress with a strong scientific identity. How does your academic rigor directly influence the quality and credibility of the content delivered to practitioners?
Yes, what we want, because there are many congresses with many aims, different aims. So what we want to do is a convention where the attendees learn something that is feasible the week after in their own office. So you have other congresses, they are more to buy new devices, because there are many booths, and you have all other, they are more for networking. So we have always our only thought in mind is to always okay, we decide to accept this lecture because we think that is really pragmatic. It is feasible in the own setting of the attendee. Because even if our congress is not very expensive, the entrance ticket is not very expensive, but you are going to deliver 2 days. You have to come, you have to go to an hotel, you spend 1 day in a flight. So I think we have a responsibility as a organizing committee to deliver to the attendees something that is going to be a game changer in their practice.
You emphasize the importance of knowledge that is immediately applicable in practice. Is this, in your view, what many events or training programs in aesthetic medicine are currently lacking?
I think they are not lacking, but we need more hands-on workshop. Everybody is looking for that. It's difficult. We organize a lot. We have a center in Paris where we organize that, the AIME Academy in the center of Paris, but it's difficult because you need patients that accept to be, for example, injected by students. There are problems of regulations about that. So it's very difficult. In fact, it's very difficult to do that because of the regulations, because of the patients that accept that. So this exists. We develop that. Others are developing that, like the IMCAS today, but it's difficult to do it, and we need more.
With the structuring of the aesthetic medicine diploma and the evolution of patient expectations, how do you envision the future of aesthetic surgery and medicine in France and Europe over the next 10 years?
In fact, on the one hand, I'm pessimistic, and on the other, I'm optimistic. I'm pessimistic because there are too much regulations in Europe, and so it is really, really painful today for everybody. I think we have in France a lot of ideas in Europe. We are draining all over the world ideas. You maybe you don't know, but the smartphone, the iPhone, was invented by a French, and it was very difficult for him to convince Steve Jobs to develop the iPhone, and then it was a success. So we have many ideas in a lot of fields, but because of the regulations, it's very difficult in Europe. So because of that, I'm pessimistic. But on the other hand, there is a demand. We have more and more people who want to have their Botox, their fillers, and so if we see what is going on in Asia, for example, is going to be the same because people want, they think that it is part of their way of life. So I think there are two forces, and in the end, we are going to find a balance.
The AIME Congress, which you preside over, has chosen to partner with Heritage Magazine as its media partner. What motivated this decision, and what do you see as the strength of this new media outlet within the landscape of aesthetic surgery and medicine?
There are many reasons. One of them maybe is not the most important, but it's very chic. So I like when you want when you are a plastic or aesthetic surgeon, you want to be associated of everything that is chic, elegant. So I think it is, to me, is the most elegant magazine today. And then what I appreciate is, in fact, is how to say is we see the magazine, but in fact, what is more important is the digital dimension of what you are doing. So, and I think you have a lot of skills, you have a huge network. So for me, it's really important. And I like the way you are doing that. Because you are doing networking a lot of surgeons, doctors that don't know each other, and thanks to you, we can network. So I think also you have also spirit. It's very your way to develop that is very friendly. So for all these regions, we decided to go with you because we are on the same page. We have the same values.
Heritage stands out for its very high-end positioning, both in scientific depth and editorial form. With a collectible print magazine and complementary digital platform, what does this approach to showcase medical knowledge inspire you?
Not the future, this is the present. Maybe you understood that before the other. So, but now it's useless to try to do that in another way. So you did that the first. You are doing that very well. So I encourage you to develop even more.
If you were to address your fellow physicians and surgeons, what would you recommend them to read, follow, or even contribute to Heritage Magazine?
Yes, they can contribute with a paper on a specific area if they know really the not the students, they have to have some skills, but they can contribute with how to say, a summary of a point that they know really well. Because heritage is a way to share knowledge in a very simple way. You are very comfortable. You look at your magazine and you don't have to concentrate too much. It's not like a scientific paper. You have to be. You can be tired and you see your magazine and you feel well. You have your coffee. And to me, it's like this. When I'm tired, but I want to learn something, heritage is good. But if you have to be very focused in a scientific paper, you have it to be in another mode. So I think the heritage can complement the daily reading of the scientific papers very well, and in a very fast way. You can concentrate all the knowledge you need. So it's very user friendly. Yes.
Thank you very much, Professor Menango, for sharing your expertise and vision, and we hope to see you again in
Thank you.
Heritage
It was a
Magazine.
pleasure. Thank you for your questions.
Thank you very much.